The second thing I want to do is describe a little bit about what I'm talking about here. And when I was first asked to talk about data and its use, I wanted to get on my soapbox. And so that's what I decided to do. And so one of my pet peeves is the way people use and misuse and abuse data because they run with the sexy headline without actually taking time to understand what's behind the data that they're looking at. Now, I do realize that I am talking to, and I am preaching to the choir here, an audience of the converted. So all I'm asking you in my presentation is you just get on my hobby horse with me, and we'll take a quick 12-minute ride, and then I'll let you return to your regularly scheduled programming. I'm going to be talking about Carroll and Owen counties. For those of you who are not from Kentucky, those are counties that are considered part of northern Kentucky, but there are some of our rural cousins. And the reason that they were picked really has nothing to do with the data I'm actually going to show you, but it's counties that I've written some grants about, so I have I've collected some data over the years. None of the data that I'm sharing with you are things that I've collected. I've merely put it together and tried to come up with illustrations of how headlines can be damagingly misleading. So the first headline I want to talk about, and I don't want you to understand that I'm saying this is a bad thing because it's a very good thing, is the way overdose deaths have been decreasing. And certainly that was a huge headline in our country starting about a year ago. Nationwide, overdose deaths had decreased significantly. And you can see in Kentucky from 2017 to 2018, they decreased by 30%. Which is a huge number, and all of that is very good. And they've continued to decrease. So I've got the latest statistics that I could find reported by the CDC, and they've gone from 2018 to 2019, a decrease of still going down of a little over 6%. So all that's excellent. And in Kentucky, too, the rates have, as I mentioned, the rates decreased by about 10%. But then the challenge, of course, is it's one thing to look at something like a state, even something as, when you compare states, relatively homogeneous like Kentucky is, say, compared to something like the state of New York or California or Texas, you still see significant differences in overdose rates. And it's very important, particularly for people who work in the community, that you don't look just at the large, high-level data, but you go down and understand exactly what's going on in your community. So, for example, while overdose deaths in Kentucky decreased from 2017 to 2018, there was an over 30% decrease in opioid-related deaths and almost 30% decrease in fentanyl and fentanyl analog-related deaths, and this was very exciting because previously it was very clear that fentanyl was driving a lot of the overdose deaths that we had been seeing. However, in northern Kentucky and Owen County, the rate of overdose deaths doubled between 2017 and 2018. And in Carroll County, it increased. It didn't quite double, but it still significantly increased. And in Owen County, it was a combination of both opioids and fentanyl. And in Carroll County, it was primarily due to fentanyl. And perhaps one reason, and here I'm just speculating, that you didn't see the full doubling in Carroll County is that Carroll County actually has an ED in it because it has a hospital. Owen County does not have a hospital, nor any sort of urgent care or an emergency department or anything else like that. And so dealing with people in health crises becomes a little bit more complex there. Okay, so we know that whatever's happening in the rest of the state and probably across the rest of the country hasn't filtered down to Owen and Carroll County as much with respect to the deaths themselves. But there's other ways to look at substance use disorder and try to measure it. One way, of course, is to look at people who overdose but don't die and to look at what those rates are like. And the natural way that we look at those rates is by checking to see how many hospitalizations there were for overdose. So how many people got transported to the hospital, how many people showed up in the hospital in an overdose situation. And what we find, and these numbers are aggregated across both counties, the trends are very similar in both. In 2017, there were 113 overdose hospitalizations, and it shrank significantly in 2018. And so one reaction you might have, and you should have, is yes, hospitalizations for overdose are going down. That's probably a good thing. But then you contrast that data with the fact that when you look at how much acute care is being expended on drug dependence or drug abuse, so it's not an overdose, but people are still seeking professional help for drug dependence or drug abuse, the numbers increased from 2017 to 2018. So what's happening here? My best guess, and I think there are other data that particularly Dr. Sadler will be able to talk about for Northern Kentucky, is naloxone, Narcan is really saturated in many of our communities. And so one thing that is happening, both to shrink probably across the nation the number of overdose deaths associated with opiates, as well as to decrease the number of hospitalizations for overdose, is that community members, residents now have naloxone available. And one effect of that, which is a very good effect, is that people are not dying as much as they used to from overdoses for consuming these drugs, and that's very important. One of the challenges is, though, for community members who might be administering naloxone to a family member or a friend, they do not report what they've done to the health department, to the hospital, or anyone else. And so any count that we now have for overdoses is going to be incorrect. It's going to be probably significantly underreported. So the fact that overdose hospitalizations went down across these two counties in 1 year, but cases of hospitalization for acute care for drug dependence went up, suggests that we haven't actually touched the issue of substance use disorder yet in our counties. We're just managing to keep more people alive, which is not a bad thing, don't get me wrong, but we're not there yet. The second trend that I want to talk about in these two counties, and if I'm right, you also see it across Northern Kentucky, and that is, who is it that is actually overdosing now? There was a presentation this morning that was showing the national data and asked, okay, so who is it that's dying from overdoses? And the common answer given is that it's between the people who are aged between 45 and 54. And the traditional story is, particularly in the rural areas, you work at a factory or you work outside, manual labor, your body starts to break down, you go see the doctor, you have chronic pain, you get prescribed an opiate, and then you get prescribed more opiates, and then you become addicted, and then, things start spiraling down from there, and we have this whole story about the deaths of despair that we are seeing in our rural areas, all of which is probably true. However, when you look at our counties, right now, males aged 18 to 34 have the greatest number of overdose deaths, the greatest rate of overdose death, more than 45 to 54. And that's been a trend that started in 2015, and it is still continuing on today. And this is a significant shift. And what is this telling us? Well, this tells us that substance use disorder or substance abuse is not starting in the late 20s, early 30s, or maybe even early 40s the way it was, because it takes about 10 years for most people to go from inappropriate consumption to, death or overdose or something like that. That means these youth are starting in middle and high school. And so what that means for people working in the community is we really need to shift how we're thinking about community outreach and the strategies we want to engage communities with respect to dealing with substance use disorder. Okay, so what happens when we look at our youth in our communities? The first thing we need to understand in Carroll County and Owen County is that a significant portion of youth live in poverty, 25% in Owen County and 31% in Carroll County. Over 50% of the youth are on public health insurance. But the one big thing I want to talk to you about is the rate of children living in out-of-home care. It's nearly double the rate that you find in Kentucky as a whole, and Kentucky as a whole is significantly more than what you find across the nation. And so we have a lot of children who are suffering from disrupted childhoods by being shuffled from their family of origin to some other care situation. The second point to make about this children living in out-of-home care, of course, is these are the numbers that we are able to track officially. Just like hospitalization is the way we can track overdose rates officially. But we know that there are significantly more numbers of children who are living in out-of-home care that's not being reported because now they're living with grandma or their aunt or their neighbor or their big sister. And that too is a family disruption that is not being reported. And so when the KIPP studies come out and you look at the number of ACEs that these children are suffering from, it's an increasing number. Also significant is that 84% of cases of child abuse or neglect in Carroll County had substance use involvement, and can't see it that far, 62% in Owen County did. So there's a very high correlation between child abuse, child neglect, and substance use disorder in these areas. Also significant when you're looking at the social determinants of health and how that impacts ultimately our youth is that less than 10% of the adults in both of these counties have a college education, which lags significantly behind what you find in Kentucky, which also lags significantly behind what you find in the United States. Unemployment rates are considered low, it's at 4%, but of course, again, this is a nice statistic to trumpet, particularly if you are, say, the president. But we know that that is not actually the most important statistic to look at, because if you're not looking for a job, you're not going to be counted at all. And the rate of people who are now over 16 but not engaged in the workforce is hovering right around 50% in both counties. One would expect this rate, just given that people flow in and out of the workforce naturally, to be around 75%. So there's a significant portion of the community that's completely disengaged from civic life. My point here is that if we want to tackle something like substance use disorder, we're going to have to come up with a better and deeper narrative than adults being misprescribed drugs to help them with chronic conditions that they have. That might be how this started, but now we have a much more significant challenge where in some ways you can look at it, our communities itself are starting to dissolve under the weight of significant pressures, some of which are brought about by substance use disorder and some of which aren't. So climbing off my soapbox, I just want to encourage you to make sure that whenever you're doing your data analysis, that you always pull back the curtain and do your best to get down to the very root causes of whatever challenges you're trying to address. Thank you very much.